in a downturn. And then for 56 to 70, there's a good chance of failure to launch. So we talked a little bit about what happens, but what's behind it? What's the cause? And I don't know if you can see that picture well enough in your screen, but turning to it on the right-hand side is a really nice picture. I just thought I would put this up there. I forgot Pharmaca. I forgot what advertisement for what drug that is. Anyway, there's a lot of different factors. Medications play a part. Obesity has a role in this. Testosterone levels, they tend to dip. High cholesterol, high blood pressure, definitely. And the medications that we use to sometimes, I want to say, drop blood pressure, those can have an effect on erectile dysfunction. Diabetes is a big contributor. Neurological problems, neurological stimulation, and then cardiovascular disease. I find it interesting that perhaps erectile dysfunction is somewhat of a warning of cardiovascular disease to come. That was kind of the idea that I was getting after looking at the literature, is that there's a cardiogenic component to it. So if you start having problems with this early on and you don't have any of the other risk factors, then the cardiovascular stands out pretty clearly as a cause. So there are other reasons too. Individuals who are on antidepressants like norepinephrine, reuptake inhibitors or serotonin reuptake, those have a tendency to put a damper on libido. So does sexual trauma from the past. One's past, psychologically as well as physically, traumatic maybe, can have an impact on one's future ability to engage in sexual intercourse. Chronic fatigue and stress, absolutely. And all the cascade of neurologic and chemical events that occur with those. Medical problems associated with, well, I mentioned it, cardiovascular, might lead to or can be an indication of disease. Hypertension, diabetes, heart disease, hypercholesterolemia, those are all the usual suspects. Low T, I haven't seen any advertisements on low T in a while. I used to see those on the TV, but I stopped watching television. Sometimes it shows up on the internet as well. Obesity is unfortunately another reason for why this occurs. How am I doing out there in Zoom land? Anybody, am I going too fast? I have one participant. And it isn't the guy. I don't think so.
Oh, you've got Mia and Paul.
Oh, I don't see Paul. Okay. Oh, very good. Okay. Excellent. Can you hear me or am I just shouting in the dark here?
Yeah, they say they can hear.
Okay, good. At least I project pretty well. I hope. I don't know. Anyway, so moving on. Oh my goodness. When I saw these drug classes, I started thinking about myself. Oh, antihistamines, alcohol, diuretics, antihypertensives, recreational drugs, medications for anxiety and depression, opioids, specialty drugs like chemotherapy, Sudafed. And I thought, God, I sometimes have to take Sudafed, in lots at one time, just so I can open up my sinuses, and I'm looking at that. Oh, okay. Well, that's a big contributor then. H2 blockers, amphetamines, cocaine, barbiturates, heroin, marijuana, nicotine, uh, any kind of anticholinergic, like a Benadryl, for instance. Anti-androgen drugs like testosterone. There's a good side and a downside, apparently, to these androgen drugs and androgen-like drugs. Is they might work to solve one problem, but they might actually lead to something that you don't want as a side effect. And in this case, too much of the testosterone or too much anti-androgen uh, medications will also diminish. I said that backwards. Too much, too little. So the anti-androgens will actually decrease testosterone. Sorry about that. So how is this diagnosed? Well, if any of you have had to deal with this, probably go to see your doctor, your physician, your provider, and you go through some questions, questions and answers, maybe a physical exam for sure. You go over maybe some pre-existing conditions. You know, maybe you have diabetes, maybe you have hypertension, maybe you're on some of these medications. So you're in a fact-finding mission here. You're trying to turn stones over to figure this out. Oh, looks like my editor got some of these words wrong. I didn't mean at to, I meant as to. And that, you know, I'm missing a few exclamation, commas, et cetera, in here, grammar, punctuation, pardon me. I mean, you know, renal disease will definitely contribute to this problem. Vascular insufficiency. Every time I went to an NIH or to a Johns Hopkins study on this, there was always a vascular problem, cardiovascular problem. Spinal cord injuries also weighed heavily in as a factor. Surgeries for sure, traumas, anything like that to the pelvic region, where nerves are cut into, blood vessels rerouted, that kind of thing, usually means that there may be some problems later on. So what are some of the current treatments? Well, all right. Some of the easy things is perhaps maybe there's an alternative to some of the medications you take that maybe aren't so vital, like an antihypertensive, but you're taking other things that perhaps you can cut out, like the alcohol, for instance, something like that, street drugs, opioids, that kind of thing. So maybe a change in dosage or medications. So it might be at least a step in the right direction. In the case of low T, that would be something between you and your physician to monitor. I don't know if the doc would send you to a specialist on that. Maybe. I'm not 100% sure on that, because we are talking about a hormone here. So that would have to be closely monitored, because the human body produces, if you're a guy, it produces majority-wise testosterone. However, we guys produce a little bit of estrogen, and there's a balance. And so if you tip that balance, then that will have an effect. The same thing goes for women. Majority estrogen, but they produce testosterone too. Usually that's through the adrenal gland, I believe. So I've got to be careful with that. Psychoanalysis and therapy might be helpful, especially when we're talking about trauma from the past. Exercises, touch technique, anything that will decrease stress. And that also would include things like, mindfulness, anything that will decrease stress, anxiety in your life. Other things too, well, picture examples here, basically are saying the same thing I just said on the left. Diet is a big deal. Eating healthy, cutting out certain sources in your diet, like red meats, instead of being so maybe sedentary, you want to get up and be more active. Yeah, this sounds very repetitive. You've heard these things dozens and dozens of times. Well, it applies to so many different areas of the body and affects so many different problems or issues that might occur as we age. So it has, multiple application. So now this isn't always the best idea, especially if you can figure this problem out and, manage it without the use of medications like Viagra or Cialis or another very popular drug called Levitra. These are phosphodiesterase inhibitors. That, in short, that means it allows for engorgement and for the blood to stay within the different chambers of the penis. That's really what it means. And these drugs allow that. So I could go over that. I just don't want to read off the slide. But needless to say that in many cases, these drugs are effective. It's just that if you take these medications on top of other medications you're on, you have to look out for side effects, especially if you have hypertension and you're on antihypertensives. There are warnings all over the drug bottles about if you're taking, these medications that drop blood pressure, you may not be a candidate for this drug. So one has to be very careful about that. So I want to say, I remember, what was it, the last time I spoke to a topic on neurotransmitters or hormones of the brain, David asked me about nitric oxide. And a good source of nitric oxide comes from carrots, believe it or not. I don't know if he's on Zoom, but he asked about that. And it's the nitric oxide that has the effect on man's ability to get an erection. All right, other treatments. I did not like this picture on the right, but it's one of those medications that can be injected into the penis to allow for an erection for a certain amount of time. And I'm thinking to myself, no. No. It kind of makes that kind of shrink up and go right back up into my body. And that's not the kind of thing I'm looking for. Sorry about that. Forget that commentary. But I thought I'd put that up there because that's what some men actually do in order to be able to maintain erection. There are vacuum pump devices that allow for drawing blood into the penis. There are penile implants. Took care of many patients that had penile implants. That's another area to look into. There's the injection therapy. I put that in gray to highlight it. That's what's going on in the picture to the right. And some of these drugs, papaverine, phentolamine, and alprostadil, are some of the drugs used. They're injectable drugs used to directly bring about a sustained erection. Because it works faster, it goes directly into the tissues. However, like anything else, loses effectiveness over time. I really wanted to know how long Viagra and Cialis, as far as effectiveness over time. I wonder, I'd have to go, that would have to be another PowerPoint. Because I imagine over time, those drugs would also lose effectiveness as one ages. Because you have to consider, what organ systems of the body filter out and metabolize these drugs. And so it's a consideration. So what's the prognosis? That didn't come out nearly as big as I wanted it to. Shoot. Anyway, that shows the stages of atherosclerosis. And that usually means there's a spot or spots where blood is having trouble passing through a normal amount of blood. It depends, treatment and prognosis depend on what's causing the erectile dysfunction in the first place. Yeah, there's nothing, from all the stuff I read, prevalence increases as men age. Fact of life. Prostate also enlarges as we age. There's another fact of life I'll get into in a moment. Yeah, the note in green is that there's a lot of evidence that ED is usually a warning sign for the eventual onset of coronary artery disease. That's not very, if it's a warning, it's a good warning, especially if it happens early. Even if it happens later, it's a warning sign that perhaps, geez, I got to look to this bigger problem that I'm having. Now, the little chart on the right underneath our atherosclerosis, which I had hoped that picture was going to be bigger. It was bigger when I originally put it up there, but I think it's wrong. It shrunk as I tried to add other things. Okay, so vascular cause from this population of men, it looks like as we age, those numbers tend to increase on the arteriogenic side versus the venogenic side in this population that was sampled. So we know there's an issue with atherosclerosis. I think in America, there's a big issue with atherosclerosis, huge one. What can we do? Well, quit smoking if you smoke. I mean, nicotine is another one of those drugs. I don't know if it showed up on that list, but it ought to, as to putting a damper on one's libido and one's ability to get and maintain an erection. Maintaining a healthy weight and diet is very essential, very, very necessary. Exercise on a regular basis, another big deal. Adequate sleep. I know, as I read in one study, I think I source it in here, problems with sleep and sleep disorder oftentimes contributes to erectile dysfunction. I didn't get a chance to look deeper into that issue by putting those into the search bar, but the fact that that's up there was a little bit alarming for me, since I don't get very good sleep. Reduce your alcohol intake is a big deal. Managing your stress is a huge deal. Examining your own mental health, most definitely. If one can do so without taking anti-anxiety, antidepressant medications, that might be one block knocked out of the way as a contributor to ED. Psychotherapy, or even going to a sex therapist. Now, I don't know what a sex therapist is per se. That was intriguing, but I thought, no, it's a little off topic. That's something else. But the fact that it showed up in my search, thought, okay, I'll add it. Psychotherapy for sure. You know, and this other slide over here, I mean, there are other ways that you can work on it. Pelvic floor exercises. I think we do some of them back here. Am I right? Pelvic floor exercises? Yes, and those are good exercises for helping for managing ED, definitely. Acupuncture might be a good idea. I like the idea of these certain foods. Almonds is, I love almonds. I love carrots. Not so huge on garlic, but I do like onions. I just don't like my breath after onions. But onions are good too. But I do like the fact that at least these four contribute to a better sexual situation, sexual life. Oh, okay. Let's switch gears now. Yeah, switch gears. Actually, the prostate contributes an awful lot to seminal fluid in ejaculation or the ejaculate. So it's very appropriate to have this with ED. So speaking of the prostate gland and aging, so BPH is very common for men, where the prostate gland begins to enlarge and begins to harden a bit. Sorry about the commentary there in parentheses. Benign, but in my opinion, maybe not so benign. Especially, I swear the plumbing works. You just got to give it a minute to get past the prostate gland. Give me a second. So, how common is this condition of BPH? I swear, I think every older gentleman I ever, helped manage in the hospital had BPH, or they had some other condition of the prostate. So I thought, very common, very common. So, and especially after age 50. And the frequency just increases little by little with age. And it's a progressive condition. And I just figure, okay, we're all going to face this. All guys, we're all going to face this issue. Okay. So what it usually ends up, what does it mean in the end is that you're not completely emptying your bladder, or it takes several trips to the bathroom to do that. The upshot, or what happens as a result, is you might be creating a nice little pool for bacteria to take over, and now you have a nice little bladder infection or urethral infection or possibly prostate infection. And that's why it's important to get this managed as quickly as possible. All right. I think I already mentioned one of the roles. It's a very big component of seminal fluid, okay, ejaculate. Because the prostate fluid actually helps nourish sperm. We'll just put it that way. It's part of that medium of transport of protection and nourishing the sperm. So that's why the prostate gland is very important, very vital. All right, here's a little bit more anatomy, as if you haven't seen enough of this already, but it's just below the bladder. That's where our prostate gland is located. Sorry for the chuckles here. This is not a very comfortable topic. Simply because if you're a guy and you get this checked on an annual basis, you probably get what is it called? PSA part. Oh my goodness, I'm having a brain fart. Yeah, prostate specific antigen. You probably get one of those drawn every year. And then you have a delightful visit to your, oh, for heaven's sake, urologist, thank you very much, who has you give a specimen of urine sometimes, and then gives you that pleasant test checking on the prostate, which I won't go into. But anyway, that aside, so the urethra, the impact it has on the urethra is that the prostate gland and the urethra are very close. Urethra runs right through it, basically, even though the prostate gland has 2 different sides, or 5 different lobes rather, and it's shaped a bit like a walnut, which to me, I kind of look at it as one side and the other side, right and left, even though it has various lobes. All right. Common signs and symptoms: difficulty in urinating, starting a stream, emptying the bladder, frequency of urination, especially getting up at night, counting the number of times that you have, nocturia, having to wake up and empty the bladder, which might be an indication of the fact that you're drinking too much before going to bed. So there may have to be a cutoff point so that you can empty the bladder more so before you go to bed. So you're not getting up 2 to 3 times a night to do so. I did mention that UTIs are somewhat common, not always. It just depends on the severity. However, if you're unable to, completely empty out, the backup of urine is not only problematic for the bladder, but also for, the kidneys and the ureters and the kidneys. So that is also another, I want to say, infection problem. Okay, how are we doing out there in Zoom land? Oh, hanging in good, good. Oh my gosh, the etiology, aging in a nutshell. Underlying and not understood. Yeah, okay, I talked to a lot of this already. It enlarges and has a tendency to harden. And when it does so, it impinges on the urethra. Okay. Let's see. If you have cancer or a history of cancer, that may be a factor as well, especially down in that region of the body. Can BPH lead to cancer? It's not considered a precursor. Some of the signs and symptoms, though, actually might be the same. Prostate cancer, from what I understand anyway, is very aggressive. It's one of the leading causes of death in men, in fact, as far as cancers go. As we age, there's also a change in hormones, hormonal balance. There is this thing called metabolic syndrome that might be a contributor too. You have, some factors like obesity, dyslipidemia, hypertension, uh, troubles with, diabetes as well, insulin resistance, so type 2. They're thought to be contributing factors in this metabolic syndrome and how it affects the prostate. Um, so I want to say an imbalance in hormones might also be a contributing factor. So I wish this graph was a little bigger. Let me see if I can read this. Oh, I can't read it. It might be easier for you out there in Zoom land to see this. Doggone it. I won't make this mistake again about trying to put too much on one page. That would have been better off on its own slide. But I think what it does is it goes into hormones and what's deteriorating or what's lowered over time versus I can't see the rest of that graph to determine what else is going on. So diagnosis, well, physical exam. By the way, have any of you out there, any of you guys out there have ever had a cystoscopy? Know what a cystoscope is? Yeah, not exactly the most comfortable procedure. No, it's not bad. It's the first time I ever felt like I was giving birth because I had my legs up in the stirrups. The nurse gave me the lidocaine and the lubricant, and then the doc came in and slid the cystoscope in, and then sent me home with a single dose of Cipro. Yeah. So, well, there's a physical exam, there's the prostate exam, PSA test. Yeah, I don't know if any of you track your PSA, any of you guys out there, but over time, I've noticed that mine has gently become a little bit more elevated over time, not in the danger zone, but a little more elevated than it was the year before. And then any signs and symptoms that between you and the practitioner come up with. Usually there's, urinary cultures or urinalysis, see what's going on further north. They may want to do post-void residuals to see exactly how much you're leaving behind once you are able to urinate. Maybe they'll put what's called a bladder scanner on your lower abdomen and take a tiny little picture of what's left behind. And generally speaking, if you're in the right spot, you get a fairly accurate number. And that will give the doc a little bit more information about, you're not completely emptying out when you do empty out, or when you feel empty, like you're emptying out, and you still feel full or half full, there may be a problem here. So some treatment. Surgical. The Roto-Rooter job, the transurethral resection of the prostate, better known as a TURP, is one option. However, there is a downside to that besides widening and getting rid of the offending portions of the prostate. is that perhaps it will contribute to impotence in some way or incontinence in some way. It's always a downside, it seems. um, that might be for a partial versus a total resection. In either case, not fun, not fun. There are some minimally invasive treatments. This Optilume, I thought, wow, I don't know enough about urology, but this sounds promising. It's a procedure where they actually seek to widen the urethra through this balloon procedure, which I thought, oh, that's great. Relieving pressure on the urethra, widening it, opening things up. And I want to say, well, it pushes aside the pressure from the prostate in order to relieve the issue you're having with the urethra, taking the squeeze off of the squeeze. So there are other things too. Part of the treatment involves constant vigilance on your part. So that means don't ignore your signs and symptoms. You may have to control your fluid intake at night or before you go to bed. May have to regiment that. Then medications that are known to cause retention. I just list a few things here, like oxybutynin. I had problems with bladder spasm, and unfortunately, that contributes to the problem. Even though the good side is it decreases bladder spasm. On the downside is that it might contribute to your BPH. So, unfortunately, Benadryl is the same way. Doxylamine, dicyclamine is another one. That's a gut antispasmodic. It's a good one, but it also, the downside is it might contribute to your problems with BPH. There are a lot of other medications that contribute. A lot of cold medications appear to be on the list of medications that contribute. Now, good medications. I don't know. Some of you may have heard of Flomax. That has been a pretty successful drug. I think I think the numbers are somewhere between 35 and 45% relief, or at least for across the board of some of your symptoms, or 35 to 45% of your symptoms. Cardura is another one, or Hytrin. They're all in the same or similar drug class. So help relax the muscles in and around the prostate, and the tissues surrounding the prostate gland and the urethra, relieving some of the symptoms, which is good. Other medications that might be used could be Proscar. I've seen that used in patients who are dealing with prostate cancer, but same with Avodart. It has a positive role as far as treatment to shrink the prostate gland as much as around 30%, which is why I've seen it used quite a bit in patients with BPH. All right. Well, the good thing is this can be managed, which is awesome. You do want to treat it though. You don't want to leave this kind of thing untreated, because in the end it could lead to things like kidney disease, infections. you don't want a backup of urine all the way to your kidneys. That's a bad thing. Cystitis, another inflammatory process, pyelonephritis, hydronephrosis, uremia, all of these are consequences of not doing anything about it or doing little to manage the problem. Education is one of the first courses of action. You want to be educated as much as possible about what it is you're taking, what you're doing that could be contributing, as well as what can I do to be proactive about, relieving my symptoms or not contributing to my symptoms. Now, unfortunately, if a prostatectomy is scheduled, these kinds of things about pre-op and post-op instructions are usually something staff will go over with you and your provider. Hopefully it doesn't get to that. It's one of those last resource, not the first thing you would go to. Any questions? Concerns?
Maybe with sex therapy, it's a valid one of therapy.
I don't know as much about that.
That's some great. It's more of therapy. Because it deals more with relational issues also.
So spousal, you and your spouse together. Now, I could see that. I could see that as having a positive impact. So from that point of view, it's almost like couples therapy in a way. Okay, that makes perfect sense to me then. That makes perfect sense. Any other questions?
None from Zoom land.
None from Zoom land? No? Well, here's a set of sources. This isn't all of them, but here's a few of them that I went to. And there were a lot more. The moment you punch in different words into your search engine, just populates either studies or websites that specialize, or I want to say it's links to either physician groups sometimes, or studies, or university. I want to say research on this on the topic, on the subject of erectile dysfunction, as well as issues with the prostate gland. Well, if that's it, and there are no other questions. I know it seems like this is mostly a guy thing, but this might be a guy and a gal thing as well, knowing that sex therapy is also plays a part, possibly in some way. It could have a positive impact on that. Thanks for bringing that up, by the way. Okay, well, I don't even know. Did we record this?
Yes.
Oh my,
Yeah.
it's forever in. Okay, I guess we should end this recording if there are no other questions.
Amen.
Amen. Thank you very much. I completely agree.